Good afternoon, everybody. Welcome to this press conference on the Commission's response to the outbreak of the coronavirus. I'm very happy to have with us two commissioners who are following this extremely closely. Commissioner Kyriakides is in charge of health and food safety. Thank you. And Commissioner Lenarčič in charge of crisis management. Both commissioners will make a short statement first, and after that we will take your questions. And I would already like to announce that as there was quite a lot of interest, we will also organize a press visit at around 4:15 of the EU's Emergency Response Coordination Centre, which will be open to all accredited journalists at Rue de la Loi. I'll come back to that. But allow me first maybe to give the floor to Commissioner Kyriakides.
Thank you so much. Good afternoon, ladies and gentlemen. As you can see, I'm here with you today for the first time standing at this podium to inform you about the EU preparedness and response to the developing situation concerning the coronavirus, which was first reported in China exactly a month ago. My priority as Commissioner in charge of health has been, and of course remains, to make sure that we as Commission provide all support to our Member States in the coronavirus context. This means ensuring preparedness and the coordination of response measures to prevent the spread of the virus within the EU. At this moment, we have 8 laboratory-confirmed cases in Europe, 4 in France and 4 in Germany. I am in continuous contact with the Ministers of Health of both France and Germany, and I am assured that necessary steps to contain the virus have been taken by both countries. I have also been in contact with the Croatian presidency and have voiced our support to they convene an extraordinary meeting of the Health Council as soon as possible. All 8 persons that I have mentioned before are under treatment in specialized infectious disease departments in France and Germany. Extensive contact tracing is underway, and measures are being taken for the persons that they have been in contact with. The situation, I know that you are all aware of, is both complex and constantly evolving. There are still significant uncertainties about the source of the infection, how virulent and how pathogenic it is. On the science front, you probably know there is currently no specific treatment nor vaccine for this disease. Knowing more about the disease would help to even better target our prevention measures and our communication, of course, to the public. China has been sharing outbreak information and epidemiological data. Rapid information sharing from China is critical, as this helps to prevent a wider spread globally and in the EU, and we are sure that this will continue. Whilst public health measures are first and foremost a Member State competence, we, as the Commission, have an important central role to support them, coordinate our EU-wide response, and help ensure that potential needs and gaps are met quickly. And this is precisely what we have been doing during the past weeks. From the very start of this outbreak, we mobilised the European Centre for Disease Prevention and Control, ECDC, to establish risk assessments. We used our legal framework and efficient procedures on health security to enable coordination of preparedness and response measures with the Member States. The Health Security Committee has met 3 times on the virus to exchange information on the situation, as well as the preparedness and needs of Member States on the basis of the regularly updated risk assessments of ECDC. They are accompanied by technical guidance documents concerning clinical diagnosis and management, travel advice, general health advice to the public and healthcare workers, advice on treatments and medical countermeasures, and contact tracing measures. Information is also exchanged in real time through the early warning and response system. During the latest Health Security Committee, which was held on Tuesday, the Member States reported to us a strong level of preparedness. Member States reported their access to laboratory diagnosis networks, guidance documents, that have already been prepared for travellers, healthcare professionals, as well as the general public. We have been working across the general spectrum of Commission services and agencies, as well as the Council and the European External Action Service. This is to ensure that we have the utmost coordinated response and full activation of all support services in order to be prepared to mitigate the consequences of a larger spread of the virus in the EU. On the transport side, for example, the European Union Aviation Safety Agency has issued recommendations to national aviation authorities, airlines and airports on how to handle potentially infectious cases in airlines and airports. Guidance has also been issued to our member states on how to handle detection at points of entry into the Union. On the research side, our supercomputer centres stand ready to sequence and simulate the evolution of the novel coronavirus. This will help researchers in their work to develop vaccines against the virus. Should the situation deteriorate, we have additional measures which could be taken in addition to those already ongoing, including mobilising emergency funding to support outbreak response. If needed, the Union Civil Protection Mechanism, now mobilised, can be used within the Union, but my colleague Yanis will be telling you more about that. We are now much more prepared on all sides, from public health to science, and we would like to say that full EU expertise and support is also provided to any third country if requested. I have been from the beginning in regular contact with Dr. Tedros, the Director General of WHO, and the Regional Director for Europe, and follow very closely the assessment carried out by the organisation. I welcome the announcements that international experts will be sent to China to provide guidance to boost the understanding of this new virus. We all understand, and I'm sure that you share this view with me, that cooperation at global level to tackle this outbreak is of paramount importance. And this is what we intend to keep on doing. Thank you very much for your attention.
Thank you very much, Commissioner. Commissioner Lenarčič.
Good afternoon, also from my side. As you know, the European Commission has a coordinating role when it comes to serious cross-border health threats in the European Union. Various Commission services and the European External Action Service have therefore been in constant contact with the Chinese authorities as well as with EU member states since the outbreak of this virus. However, as the outbreak of this virus has intensified, the Commission decided yesterday to step up our preparedness and response activities. Upon the decision of President von der Leyen and in my capacity as the European Emergency Response Coordinator, we have initiated a strengthened coordination between our relevant services. In addition, as it was already communicated, President von der Leyen spoke to the Chinese Prime Minister this morning to convey our willingness to assist if required and to cooperate closely in managing the developments. Currently, we are actively coordinating and accompanying Member States' intention to repatriate EU citizens from China. There are a number of EU citizens in China who would like to leave the country. The current number is about 600, and that they cannot do so at the moment. And as announced yesterday, France has activated the Union Civil Protection Mechanism via our Emergency Response Coordination Centre in order to coordinate the repatriation of EU citizens from Wuhan with airplanes. In this respect, our Emergency Response Coordination Centre has organised a coordination meeting with Member States in order to ensure that all of them have the same information and can make their needs known. For the time being, not all Member States have provided us with the information concerning the number of their citizens to be repatriated. Nevertheless, the estimate is, as I said, about 600 at the time. Also, at this time, the French authorities are in close contact with the Chinese authorities to work out the operational details in order to perform the announced flights. It is important to understand in this context that regarding the circumstances, this is a very complex operation that requires time and patience. In addition, it is also important to know that the Union Civil Protection Mechanism can also be deployed outside Europe. This is why we are in contact with the Chinese authorities, and should assistance be requested by China or any other third country via our Union Civil Protection Mechanism, we can facilitate either the deployment of our emergency medical teams, or the mechanism can also be activated to provide other assistance, for instance, provision of personal protective equipment stock. Regardless of potential activation, we are monitoring the global situation comprehensively in order to be able to cooperate with China and others in the most optimal way. In fact, the Emergency Response Coordination Center is in contact with the Chinese authorities who are interested in purchasing certain equipment. So, besides the numerous efforts of Commissioner Kyriakides and her services related to our medical response, the search for vaccines and medication, as well as medical capacities in member states, the Commission is active on a number of fronts. We are also following member states' efforts to control incoming passengers from China at European airports. To sum up, the Commission services are fully engaged in monitoring and responding to all possible facets of this outbreak. As of yesterday, our management structures have all been mobilized. Based on our knowledge today, we expect that this coordinated effort will need to be pursued in the forthcoming weeks and probably months. So much from my side.
Thank you very much, Commissioner. Ladies and gentlemen, yes, now the floor is totally yours. I already see 2 hands there, and then I will take the gentleman. So, yes.
Thanks, Angelo Di Mambro from ANSA. Regarding the repatriation mechanism, could you please, there have been many press reports and it's not clear what nationality these citizens are. Could you please tell us something more about the nationality of the European citizens that are still in Wuhan, and that these 600 people that should be repatriated? And to Commissioner Kyriakides, if I may, in the minutes of the Health Security Committee, okay, there is an assessment that says that a strong level of preparedness, but there are still a number of gaps. Could you please tell us what kind of gaps are those? And if you could, sorry for the third one, and then I stop. You mentioned funding in the case the situation might deteriorate. Could you please elaborate a bit further on that? Thanks.
Commissioner Lenarčič, will you maybe?
Thank you for the question. We still do not have the complete feedback from all the member states, but those that have come back to us reported that the following citizens of the following EU member states would like to be repatriated: Austria, Belgium, Bulgaria, Germany, Spain, Finland, France, Italy, Latvia, the Netherlands, Poland, Portugal, Romania, and the United Kingdom. As for the funding, when it comes to repatriation, the mechanism can provide for 75% of the transportation cost.
Commissioner Kyriakides.
Yes, of course. I had mentioned the outcomes of the Health Security Committee, but I will go into more detail. It met, as I said, for the third time. The preliminary assessment that the Commission had on the information provided by the EU member states indicated a high level of preparedness, and arrangements were in place to ensure that all member states had access to laboratory diagnosis, had issued guidelines for travellers, and are preparing health systems. The member states continue to provide detailed information on their plans. They didn't report any major challenges regarding stocks of personal protection equipment, but as you understand, it is a rapidly evolving situation, and we need to constantly be in touch with member states to see that if this situation changes and any gaps are seen or observed, we can immediately act.
Follow-up?
Maybe I got it wrong. When I was asking about funding, I was asking to Mrs. Kyriakides that mentioned that maybe mentioned that should the situation deteriorate, we are ready to mobilize funding. For us, is for what? I didn't get this. Sorry.
Funding, of course, is something that will be considered if the situation so needs it, for example, for vaccine development or other issues. But we are not there now, so this is just something that I mentioned in case the situation deteriorates. I'm sure that all of us here hope that it doesn't.
I will first take a gentleman there, then a gentleman here, and then we go to the lady.
David Carretta, Radio Radicale, Italian radio. Two questions, if I may. The first one is about the European Union staff. Are they allowed to go to China, or are you going to take measure to avoid possible contagions and so on? The second question is about British Airways that stopped flight to China. Do you think that other airlines, European airlines, should do the same? Is it the right way to proceed? Thank you.
Thank you. On the first point, travel to China. This was one of the issues that we discussed yesterday at our coordination meeting, and we agreed that we will advise all the Commission and EAS staff members to suspend or postpone all non-essential travel to China. On your second point, the decision of British Airways, I'm aware of it. I don't know about the immediate reasons for this decision, but of course it's the decision of airline itself. At the moment, we are collecting this kind of information, following the developments, and exchanging information with the member states. We will see what decisions need to be taken later on as we see the evolution of the situation.
Can I also come in on this and add to what Yanis says, that, as you know, decisions on travel restrictions are the responsibility of member states. So I would just like to tell you that as of 24th January, WHO did not recommend any specific measures for travellers, so it's something that we are following and following what member states are implementing. Thank you.
The gentleman, the lady, and then you.
Thank you. Roland Siegloff, German press agency, DPA. The 4 cases which occurred in Germany so far are linked to a company based in Bavaria and having production sites in China. You said that the situation is constantly evolving and this is not going to stop soon. Does the Commission fear that this might be a threat to economic exchange with China on the midterm run? Thank you.
To the first question on that, I think we have to be very careful in how we're responding to all the information. I had a communication with the German Minister of Health, and he assured me that all measures were being taken. They have recognized 4 cases from a specific company where the workers were in touch with someone who had in fact come from China, so it wasn't out of the blue, and they're at the moment monitoring the situation. I would hope that they manage to contain it to that. Thank you.
Perhaps, if I may add to this, we hope the situation would not deteriorate, but it is likely that it will get worse before it gets better. That's why we are saying we are following the situation very carefully, and we try to calibrate our measures and our response accordingly to the situation as it evolves. You mentioned economic considerations. I would like to assure you that for us, for the Commission, the public health is on the top place, or the first place of our considerations.
The lady, and then afterwards we go to you.
Okay. Ana Neves from the Portuguese news agency. I would like to know if you have specific figures related from how many citizens from each EU country will be repatriated due to this virus. And can you please confirm if when it comes to Portugal, it will be 14% people? Thanks.
Fortunately, I do not have the precise figure because they evolve. We are currently, as I said, close to 600, those who signaled their desire to leave China. But we can provide you the exact figure at this moment later on, because we do have figures at the moment.
Yes, madam, and then I will take your question, sir.
Hi, thank you. Carmen Palm from Politico. Commissioner Kyriakides, you mentioned the possibility of an emergency or extraordinary health ministers meeting. Why do you think that is necessary, given that we only had 8 cases so far confirmed in 2 big countries with what is thought to be robust healthcare systems? And given that in the past the Commission and the EU has dealt with avian flu and swine flu outbreaks, and in retrospect, in some cases, people bought stocks of vaccines or other equipment that they didn't use. Is there a risk that this might happen again in a similar situation? I understood that those decisions were also taken after health ministers met and there was panic and people bought 16 million vaccines that they didn't use. Thank you.
Well, as I had mentioned at the beginning, I'm sure you're aware that in this case, I don't think that will happen. For the moment, unfortunately, we don't have a vaccine. So we're not at that point of discussing this. But yes, I have fully supported the request that the Croatian presidency convenes a Health Council meeting, I think for 2 reasons. It's very important here that we understand that we mustn't underestimate the situation, and we need to mobilize all our tools. We must have reactions which are proportionate to the current situation that we have now. So bringing the health ministers of the member states together will provide useful information about the situation in all member states, will allow the sharing of information to see the level of preparedness, and, as your colleague previously mentioned, to really pinpoint if there are any gaps, where these are, and where member states can act proactively. So that is why I consider it important that we hold this Health Council when the Croatian presidency calls it. Thank you.
Follow-up?
I was wondering if you heard from them, if you had any sense in timing. We were reporting today that the health minister in Croatia was just changed. Thank you.
Yes, you're right. The health minister in Croatia has changed. I don't have a sense of timing, but I'm sure that they would look at it with the urgency required. Thank you.
You, sir?
Athanasios with the CNA. Commissioner, how satisfied are you with the health and personal hygiene culture here in Europe, in the European Union, especially now that we are in the virus season? It's not only the coronavirus, but it's every virus that surrounds us. And what health professionals have been telling us the last couple of weeks is that most of the individuals do not really take the precautionary measures that are needed. They go to work, they expose their colleagues to the viruses they have caught, they cough and they sneeze without taking precautions, and this is more widespread. Nobody ever uses a mask, as people in Asia usually do. So I know this is a threat. Everybody sees it as a medium risk, as the ECDC says, but still, if someone contracts the virus and it comes to Europe, is our, let's say, personal hygiene culture ready to tackle the situation, or are we practically unprepared in this level, if it comes? Thanks.
Thank you, sir. Well, our personal hygiene culture shouldn't only come to the forefront when we have to deal with a virus. I mean, it's something that we should have inbuilt in us. There is, as Commissioner for Health and Food Safety, I don't think you would expect me to say that we are where we would want to be generally with our health hygiene culture across member states at all times. It's something we need to have and build on this culture through awareness, starting at a very young age, from children in schools, in families, so that when we have a situation as we have now, it is inbuilt to us. And these things don't change overnight, so there is work that we need to do. WHO has put out guidelines on numerous times about personal hygiene, which are accessible to all so that they know what measures they should be taking. But it's an ongoing, building awareness is an ongoing process, and changing culture about personal hygiene is something that needs to be built up from a very young age into adulthood.
Follow up.
So this winter, would you encourage everybody who has contracted a virus not to go to their workplace and expose others, no matter the pressure from the workplace?
Finds out about WHO for those who have contracted the virus, and I think that they're very clear, and I will stay with those. And I think that generally what we need to be aware of is that whenever we are feeling unwell in any way, we need to be not only responsible towards ourselves, but to the others around us. But for the coronavirus, WHO has issued, and ECDC, the European Centre for Disease Prevention and Control, has issued guidelines on what those affected should do.
Do we have any other questions? Now is the time. Yes.
Yes, thank you. Let me just go back to my list. I wanted to ask about the emergency reporting mechanism, because as far as I understand, there, EU countries or European Economic Areas countries, if I'm not mistaken, have to report confirmed cases, but also probable cases. Do you have a figure of how many probable cases we have in Europe? And also, yesterday, the WHO was saying that they have agreed with the Chinese government to send international experts. Are you in talks with WHO or with China with possibly sending European experts to China? Thank you.
We're in very close cooperation with WHO and, of course, very close cooperation with all the agencies. I can only give you the numbers that I have as of this morning. Which is that there are 6,074 laboratory confirmed cases, including 16 health workers in China, and 132 deaths. I don't have. I have the numbers reported in the various countries and continents. I don't know if you would like me to give those, but I don't have any numbers for potential cases.
Can I just clarify that? So my question was related, because as far as I understand, in the European warning response system, if I call it correctly, European countries have to report either probable cases based on very specific criteria or confirmed cases? We know so far of 8 confirmed cases. I was wondering if you have the number of probable cases that have been reporting to the EWRS in Europe as of the most recent you have. Thank you.
No, I don't have those numbers. As you have said, the early warning and response system is used by the Commission and, of course, by EU countries to send alerts about events with a potential impact on the EU and to share information and coordinate response. I don't have any numbers that you have asked for.
Yes, another question there.
Thank you for the second round. It's more a political question than a technical one. Do you trust China? Because we are reading a report of the China government hiding the first cases of the virus, even the mayor of Wuhan in an interview saying that the Central Power told to him not to reveal the cases. There are rumors of China pushing members of the International Health Organization, World Health Organization, to avoid declaring planetary emergency. I mean, do you think that we can trust the communist regime in China? Thank you.
Do you want to take it or shall I? I'll come in after you.
I can only say that our cooperation with China so far has been good on this issue.
And I would like to add to that I think that speculating and hypothesizing is not going to be helpful when we're dealing with the situation as we are now. The ECDC is in contact with the Chinese Center for Disease Control, and we have no indication that there isn't a good cooperation, so I don't think we should be at least self-commenting on speculations.
Any other questions, Lisa? Yes, that's third rounds. Okay, I'll take you in the back and then...
Thank you very much. This is my final one because actually it's just reiterating the previous one about the international experts. I didn't quite get whether you are in talks at all to send any European experts as part of that international groups of experts that China agreed with the WHO that they will receive. Thank you.
The WHO is in contact and the General Director has been there. And we're in contact with them to see any support that they need and require.
Yes, sorry, Commissioner.
On this issue, I could inform you that if China would wish to get experts from the European Union, it can do so, it can request so through our Union Civil Protection Mechanism. We do have at our disposal the so-called Emergency Medical Corps that can be deployed inside or outside of the European Union. It is composed of 7 emergency medical teams, 3 advanced medical posts, 2 medical aerial evacuation assets, and 2 mobile laboratories. This is all available upon request and activation of the Union Civil Protection Mechanism.
Thank you, and I will now take the last question.
I don't think you mentioned that, but what's going to be your strategy towards the European Commission employees who serve in the delegations and representations in the Southeastern Asia? Thanks.
Sorry, are you going to come?
Well, this is part of the European External Action Service responsibility. As I already mentioned, yesterday we discussed the issue of travel to China, but also travel from China to Europe on official business. The decision was taken to advise our staff, both the Commission staff and the staff of the EAS, to suspend and postpone travel to China and vice versa. So the staff of the EU delegation there are advised not to travel unless it is absolutely essential.
Thank you very much, ladies and gentlemen. I still have 2 things to share with you. The first, as I said in the beginning, is that as there was quite a lot of interest in this, we are organizing for you a press visit at 4:15 of the EU Emergency Response Coordination Center, which is open to all accredited journalists. It's located in Rue de la Loi 686, I've been there a couple of times. It's really impressive, so I warmly recommend you to go for that press visit. And then if you want more information, my colleagues Daniel and Balázs there can help you. And finally, I would like to thank Commissioner Kyriakides and Commissioner Lenarčič for having taken the time to share their views with you. So thank you very much and have a nice afternoon.